Welcome to the CanDo podcast. Ladies and gentlemen, I've got Ginger Cochran, a registered dietitian, functional medicine, certified diabetes education. I want to spend a little bit more time on that. Congratulations on all the awards, and if I'm reading here correct, Young Dietitian of the Year.
Yeah.
Tell me a little bit about all your accolades. I mean, nobody can tell the story about yourself better than you.
Yeah, so I have my master's degree in exercise physiology. I'm a registered dietitian nutritionist, but I'm also a board certified diabetes education care specialist, which means that I did extra education and work to focusing on just diabetes care, education, treatment, and then that passed a board exam. So I did that. I also, because I have the master's in exercise physiology from Cal Poly San Luis Obispo, I also have the certified exercise physiology certification. So I really like to intertwine everything all together. And then also the certified wellness coach as well to round things out.
To add more things to your plate. That's incredible, right, Ginger. Thank you. How many years of schooling was that for you?
Oh gosh, that was like 8 years with my internship. It took me a little bit longer in graduate school since my undergraduate degree was in nutrition. So then I had to to get exercise physiology, I had to do some undergrad work first. It took a little bit longer, let's just say.
Tell me and tell our audience where the passion for nutrition comes from. Why are you in the field that you're in? Tell us about your experience and your why behind what you do.
So my curiosity with nutrition and wellness and prevention really started very early. When I was around 4 years old, my father got really sick with some unexplained illness and kind of hopping around to all kinds of different clinics. And then my brother got juvenile rheumatoid arthritis. So he was in a wheelchair. And the doctor said he would never walk again. And I watched my dad focus on nutrition and herbs and prevention, of course, like also bouncing around to all the doctors trying to get treatment, kind of getting pushed around a lot. And I saw how much it at least prolonged his life. He did pass when I was 16 years old, but he definitely lived past what doctors would said he would live. And then for my brother, through nutrition and adjustments, kind of doing more of a holistic approach, he was, even though the doctor said he would never walk again, his juvenile rheumatoid arthritis went into remission. And so I saw the power of diet as opposed to just conventional medicine in recovery and healing for both of them. So then I was also used to being in clinics and patients and doctors too. And so it felt pretty comfortable. And then when I was in high school, I developed more of a curiosity with nutrition. And it was one of those things like I could pick up a book and not stop reading it. So I was like, oh, I should probably go to college and learn more about this. And so in college, I definitely like wavered between like becoming a nurse or a dietitian or a physical therapist, kind of went all kind of around, but the life led me down becoming a registered dietitian and then the diabetes education specialist.
So, and explain, and I'm sorry for being elementary, so has diabetes personally affected you?
Diabetes, recently my blood sugars did kind of become really high, but I've always had what's called reactive hypoglycemia. So that means I'm very sensitive to carbohydrates. So my blood sugars can go up and then like tank down. So I've always been sensitive to blood sugar levels, not so much diabetes. I developed my diabetes like passion is because I saw what an opportunity there is to really decrease a lot of comorbidities and diseases through controlling your blood sugar. And then I got really into gestational diabetes in the past 6 years because I love being part of that journey of pregnancy with moms. And it's kind of like they have to become and understand the gestational diabetes diet. So diabetes diet within like a day, because they get diagnosed and then they're told they have to follow this diet now. And so it's kind of like very immediate, change that they have to make. And it can be very stressful for many moms, while, other people might have pre-diabetes, kind of like waver back and forth. And so that's kind of where my journey went.
Interesting. Talk about educating new moms, because number one, they're so excited about being a mom and a parent. Obviously, for the first time or multiple times, it can be overwhelming.
It
How
can
do
be.
you go ahead?
It can be really overwhelming. That's why I'm so passionate about it. I like to, be like a sounding board for them, listen to kind of what's going on, where they are at emotionally, because emotions and stress can play a role in their blood sugars too, and and how they're able to manage their diet. But I like to provide them tools. So like, one of the CanDo bars, I give them like little goodie bags when they get diagnosed of different samples of different products that companies give me, and the CanDo bars are in one of them. And so like, I like to give them focus on the tool. So hearing them and educating them on what gestational diabetes is, but also giving them tools. Through my work, I have seen the gap in care. So of where not everyone gets to meet with a dietitian, or a dietitian that understands the gestational diabetes diet, because it is a specialty. It's like a specialty within a specialty. Like you could understand diabetes, but not understand gestational diabetes, because we treat it a little bit differently. And so there's a big gap in care there. So that's why I also created my website, which is gestationaldiabetesnutritionist.com, and have, free resources, blogs, and things like that on there, plus a master course as well on there for people to access.
Well, thank you so much for being an advocate for so many people. Is the digestional diabetes fairly common? Walk me through that. I'm not familiar. I'm just trying to educate myself and educate our listeners.
Yeah, so it's very common. Pretty much anyone over the age of, everyone's at risk of getting it. It doesn't matter, anyone can get gestational diabetes. So their statistics show that it's about like 9% of women, like 30 to 34%, 30 to 34 years of age. And then about 12% of women get it between the ages of 35 and 39. So it's just, the risk goes up every year, but you could be under 20 years old and still get it. It's just the risk is a little bit lower. So in my population here, where I live in San Luis Obispo County, we have a lot of women that are in their 30s, 40s getting pregnant. So the risk is very high. It's like, more than 1 out of every 10 is going to get it. So.
And then what kinds of foods I love food. That's why we're in the food business. I've been up in weight, down in weight, sideways in weight. Everybody tends to fluctuate. What kinds of foods are assuming low sugars, stay away from sugars. Talk to me about, you offer diet plans, or I don't even call it diet. I call it like learning an appropriate language, like you're learning Spanish or French.
Yeah, so we'll go over like reading the nutrition label. I'll give them like a meal plan ideas that can be in different, meals that can be tailored to them. But essentially what we're trying to do is focus on blood sugar balance. So they're going to be very sensitive in the morning to carbohydrates, which turn into sugar, right? And so they're going to more focus on something that's less than 15 grams of carb, usually in the morning, 15 to 30 grams. Kind of depends on how sensitive they are. But I educate them on you can't eat these carbs by themselves, right? So you have to eat more protein or healthy fats with those carbs so you don't get that big spike. Carbs by themselves are the quickest to digest, and proteins and fats are a little bit slower. So we have to have the protein and fats in our stomach to keep the carbohydrates from spiking our blood sugars too quickly. As these women have, because of the hormones, is created insulin resistance. So insulin's that hormone that puts sugar in the cell. So their cells aren't working to put it in the cell any longer. And the body naturally does that in the third trimester to divert extra sugar over to baby because baby's growing more rapidly. But some women just do it too much, and then too much sugar goes over to baby. So we really have to watch the carbohydrates because the carbohydrates also turn to sugar. Then like every snack is about, no more than 15 grams of carb, but again, paired with that protein or fat. And then lunch is about 30 grams of carb paired with the protein and fat again. Same thing with dinner. So it's all about balance. So when I, like, for example, with the CanDo bars, I'll use them as an example to show them like, okay, so we want to make sure that there's more protein or fat in this one item than there is carbs. Because we know if there's more carbs in our stomach, our blood sugar is going to come up, right? But if there's more, this is my version of a bar. But if there's, so if there's more carbs in it, their blood sugar is going to go up. But if there's more protein or fat, then we're not going to get that big spike. So, I might pull out one of the CanDo bars just to show them, okay, this would be a good example of a bar you might have because it's not going to make your blood sugar spike. Well, if it was something that had more, carb than protein, like let's say a small apple, well, then I'm like, okay, well, that's fine, but we need to have it with like peanut butter or a string cheese or something like that. You still have to balance it. So it's not that we can't have carbs, it's just how you eat them.
Correct. Can you name for me your 3 favorite superfoods or functional foods that you love?
Yeah. So I love blueberries.
Yeah.
And I just was at an interesting talk where talking about your decrease in dementia with blueberries. Then I would say turmeric would be another great functional food. I guess that's more of a spice. And then ginger.
Right.
Mhm.
And why do you think like ginger and turmeric are other than why do you think that they're so important to the digestion?
They have super anti-inflammatories in them, so it's reducing inflammation throughout the body. And there's a lot of diseases that come out of a state of inflammation, whether it's just like joint pain, heart disease, cancer. So there's lots of research that show that foods that are high in foods that decrease inflammation can help reduce those things. So if there's a recommendation to eat 8 to 10 servings of fruits and vegetables a day, has been shown to decrease your risk for cancer. And a lot of that is, the chemicals that you can find in plants that kind of help heal and reduce inflammation in our bodies.
Right. You kind of answered this a little bit before, Ginger. With the abundance of information available on nutrition and wellness, it can be overwhelming, especially for new mothers or new folks. How do you help them manage the overload of information and how do you make it simple?
So, I provide, handouts or my website to kind of just like break things down or different resources that they can, look at. There's a sea of information and it can be overwhelming, especially with, so many influencers that do not have a health care background or degree. But I try to provide them simple, realistic action points and goals. I'll educate them, but then also set like specific goals for their lifestyle, whether it's, someone that has gestational diabetes or they're pre-diabetes and seeing me or have type 2 diabetes. I give them the actual action points, but then also give them resources and more things that they can look up on their own. Also, if they want to visit my website, even if they don't have gestational diabetes, the information is focused on blood sugar control. So whether recipes or articles are all that are on my website will help balance things out.
Without going into too much private detail, can you share a story or stories of some of your most fascinating patients?
Sure. So I've had patients where, I've had quite a few where it's their very first time with gestational diabetes or getting diagnosed with pre-diabetes. I point over here because this is where my patient seats are over here.
You can point anywhere you'd like. You can use hand gestures, you can smile. Love it.
And so, but I've had quite a few, especially with gestational diabetes, where they're like so overwhelmed, but because it's kind of like a crash course and these moms are so motivated to do it for their child. I think a lot of people, when it's just for themselves, we aren't always as motivated, but when you have something that really like burns that fire and desire to change, they can make amazing like adjustments in their life. So I've seen quite a few women where when I'm done with them, they've delivered their babies, they don't have gestational diabetes anymore, they'll lose weight because also the eating plan or way of eating that controls your blood sugar also promotes weight loss. And so, naturally they won't be as hungry postpartum or, after they're done breastfeeding, and they tend to lose weight. And so I have a lot of moms that are like completely blissfully happy, learning to have a good relationship with food. It's not about being on with like eating plan or way of eating like 100%. I just say it's like, 80, 20, 90, 10 rule, so 80 to 90% of the time you're following this lifestyle, and then 10 to 20% of the time you have your treats. So there's a lot of women that learn through this crash course of being forced to eat a certain way that they feel better, and they've lost a considerable amount of weight, and it improves mental health. They feel better, and that they're at their healthiest weight. And so I've had that many, many times, or people discover that that they just like eating that way. So people tend to feel better once they're controlling their blood sugar, regardless if they have diabetes or not, or pre-diabetes or gestational diabetes.
And just curious, you're fascinated to hear these stories. What excites you the most about the field, or the patients that you work with, or like obviously it's all exciting, and you do it for the people, and you do it for making somebody independent and being able to live their life to the fullest. But what's the most exciting part about your job, or about what you do?
I think seeing the mental health improvement and the energy they have and the better quality of life, seeing them understand it and making their own choices. My goal is for them not to be reliant on me for, goal setting every week and things like that. When they can get that intrinsic motivation because they feel good and they're changing their lives, and it's kind of affects the whole family. That's what feels amazing to me.
That's great. Can you talk a little bit more in detail about the relationship between mental health and your particular diet?
It's strongly related. And so they call the gut the second brain. And there's a whole studying the microbiota of the gut. If there's an imbalance, there directly is increased risk of, depression, anxiety. It's kind of like this vicious circle, because then that can also make us crave more carbohydrates, which causes an imbalance, or more sugar, and it kind of goes around and around. But there's a lot to link between diet quality, making sure you're eating healthy fats, high fibers, keeping a balanced gut bacteria, between mental health. Also, there's a lot of people that, and I see that quite a bit, that, if they've had trauma in their past, that they have a lot of abdominal pain. And so it's not until they've done, therapy with a mental health worker that understands trauma treatment until their gut pain actually goes away. So I see a lot of people that have also irritable bowel syndrome, constipation, diarrhea, and a lot of that can be linked to mental health and needing to work with someone on, healing that trauma, but also you need to feed yourself well. So it's kind of like, it's a circle. And so trying to work with, multiple disciplines to help someone heal mentally and physically is really important.
Yeah, all this is terrific feedback. And what is, and you kind of talked about this earlier, but I want you to talk a little bit more in depth. What are some actionable steps that someone, listening to this podcast can say, all right, I want to explore what I'm eating and see really if I'm doing an okay job, where could I tighten up? How do I kind of put my diet through a test to see what can I add, what can I eliminate to make sure that I'm operating at, the highest possible mental health that I can. You talked about blueberries and how that helps. What are some other things that, if I wanted to do an assessment, be like, Adam, you really should cut this, where do we get started?
I would say start with a food symptom journal. Every day write down how you feel, any GI symptoms, meaning are you constipated, diarrhea, are you anxious, feeling more depressed that day, like exactly how you feel. If you can make a diary like that for a month, one, you'll probably naturally just start eating better, like unconsciously, because anyone that writes things down, they just naturally tend to do that. By always, ideally, yeah, you're working with a registered dietitian nutritionist and going over this, but alone, you can also just see, start seeing the correlations, like, oh my gosh, I ate cereal twice that day and I felt super anxious the next day. Maybe there's a correlation with, like, maybe it's too much sugar or imbalance in blood sugar, and that's why you felt anxious the next day or tired the next day. So it's kind of like you can start seeing these patterns if you start documenting things too.
So because of your wealth of experience, I'm going to ask you to cheat a little bit. Or not cheat, but kind of give your forward knowledge, if you will. So if I had 3 bowls of sugar today, 3 bowls of cereal today, you would say, well, Adam, probably you might be a little bit anxious because of the ingredients in there triggers some things. Whereas if I eat, a salad or something, I might be more calm, or maybe my gut. Is it as simple as that, or is everybody's body different, or do you understand what I'm going?
Yeah, everybody's different. So it could be, if someone's prone to anxiety, it could be like they feel a little bit more anxious the next day. If someone's more prone to constipation or diarrhea, everyone senses things different. Another person could have cystic acne. We just all kind of show our imbalances differently. It could be all the symptoms. But yeah, I would say looking at that balance in the diet, also making sure you're having healthy fats too, like avocados, nuts, seeds, whole foods as much as you can. But seeing those, writing that kind of journal just really helps bring things to light. Because many times life is busy. We're all doing many different things, you know, and so we kind of tune things out. And I think it's once we have the evidence and you can kind of see in your own journal that it's easier to see the patterns.
That's great. Throughout your career, you've been doing this a lot. You've been on several TV shows. You know, certainly you're on social media, on your website. You've got an extensive list of clients and mothers, especially in your area. What do you hope to continue to do going forward? And then also, there's a second part of that. Are there, you know, we talk a lot of foods have functional values to it. What are some real functional foods that you like? You know, like maybe caffeine.
Yeah.
Or that might be a bad example. Or, you know.
I mean, I love for functional foods. I mean, every food technically is a functional food because it serves a purpose.
Correct.
But there's some that do some extra things. So, you know, dark chocolate, for example, really dark chocolate, you know, like I'll make my own 100% dark chocolate. And that's a great way to, you know, not only it helps benefits mood, it's not, you know, the higher the percentage, the lower the sugar in it. So it's will balance your blood sugars. So there's a lot of different things that functional foods that I like to eat regularly in my day. Green tea is a great one, super anti-inflammatory. But I mean, my hope is through my different,
Sorry, did you say green tea?
Green tea.
Yeah, I'm a big fan of green tea.
Yeah, and so particularly matcha. I love matcha. Not that I don't love coffee. I love coffee too. Kind of alternate between the two. But yeah, my hope is to not only like be an example of healthy living and balance between, you know, because it's not just nutrition, it's, you know, your sleep quality, how you manage stress, things like that. So being also an example in the community, and whether it's social media or my local community, and but also sharing, you know, my own tips and experience, whether, you know, it's a free channel like Instagram or my blog on gestational diabetes nutritionist.com, or like a paid for, you know, holistic program through my master course. So I'm just trying to help increase access to health information.
Great. And outside of your work and being a teacher and an advocate for folks, what kinds of hobbies do you enjoy doing? You know.
So I travel. I love to travel internationally. So that's one thing I do, just always looking forward to a trip. So my next trip is to Belize for my birthday.
Oh, really? When's your
know.
birthday?
It's in January.
Good. A good friend of mine is actually from Belize.
Oh, really?
I've never been there, but he goes there multiple times a year. He's from Belize, a really good guy. Yeah. Have you ever been to Belize?
I've never been to Belize. I've usually like traveled to Europe and around the United States. So this is my first time going to Belize.
Yeah, I was looking on your social media and for show prep, and I saw you're on a lot of these cool islands and beautiful places where waterfalls and greens, and I certainly wanted to talk to you about that, because I think that diet and giving yourself time to do those things and looking forward to it all helps, you know, in the whole big picture, right?
Yeah, focusing on self-care is important. I go to yoga or I meditate every day, or I'll go to my yoga classes, and of course I exercise every day. So It's just kind of prioritizing your time. I might not have my hair perfectly done at work, but I went on a walk for at least 30 minutes in the morning, so it's, that's how I practice self-care. I know I'll be a better provider, and manage my own stress if I take care of myself.
Well, I really, really appreciate you spending a few minutes with us today on the podcast. I do want to ask, in the spirit of can do, what is your biggest can do moment? What are you most proud of? When I say can do to you, Ginger, what does can do mean to you, for you?
Can do means to me that you can, if your heart's in it, you can do whatever your heart's in. So like this past year was developing my business that's on my side business with gestational diabetes. And I took courses, learned how to make a website, and I figured it out. So it's really that you can do it. It's just, it's literally can do. And so that it's staying positive and believing in yourself.
Great. Well, that's wonderful advice. But you've been absolutely phenomenal. I really enjoyed our conversation.
Me
I
too.
know that you will help multiple people and continue to do that in your quest for a better living. And it's not just by eating, it's, taking time for the mental part of it too, and just being balanced. We talk about balance all the time, and nobody can be perfect every day, but I really, really enjoyed the time. Is there any questions that you have for me?
How did you get started with CanDo?
Great question. So I've always been a foodie, and I, if CanDo started as just for us, my brother and I always say my brother's my heart, my sister's my soul. And we've always had an incredibly, incredibly tight family. And I love people, and I love to make people happy. And I'm so grateful for people for giving me an opportunity. They knew that I was special, not because I sit in the chair, but because of the heart and compassion and love for life and my positive attitude, that you can do anything that you put your mind to. And how I got started specifically in the business, I was about 60, 80 pounds overweight, and really, really hated how I looked and how I felt. And so my brother was so badly deconditioned in an accident, we couldn't go out to dinner. So we have a friend of ours who came over a couple nights a week, and Gabe cooked for us. And so during that time, Gabe also got me into the pool, and we started working, like walking little by little. And I started to see some success with my diet, and then success in the pool. And then Gabe and I just continued to work on my diet, basically cutting carbs and sugars. And I was following basically the keto diet. And you remember 3.5 years ago or so, the buzzword around diet, carbs, sugar, higher in fat, basically keto. And so I had adopted that lifestyle and taught myself that language. And my brother and I sat down with a food scientist, and we wanted to create something that tasted great, which also had nutritional value. Now we understand that food tasting great is subjective. That's why we want to sample it and allow people to try it. But we really feel good about the taste and texture of the bar and the nutritional value, and our ability to want to inspire and empower people to live healthier lifestyles, whether it be through food, conversation, giving somebody a hug. I always say cheer for people, and people cheer for you.
I love
And
that.
I just think it's really fun and exciting for me. The bars are just a platform for me to be able to talk to you. Without CanDo, you wouldn't know about our brand, you wouldn't know about me. but I'm better today because I had a chance to meet you, and I hope the feeling is mutual.
It is.
And that's how things kind of snowball, and all I want to do is support everybody else, and by doing that, it's gonna help me and help others. So really that's how it all got started, and just my passion and love for people and love for life. You know, the foods are gonna come and go that we eat, right? But the relationships that you make, the time you spend to ask questions, to really give a damn about people is really what is special.
Yeah.
And you know, so we've had the fortunate success of starting with 3 bars, and now we've got 9, and there's more innovation in the pipeline down the road, and it's
Awesome.
all, I always say we're a customer service business first, a
Mhm.
food company second, because
Amazing.
it's all about the people and
Mhm.
being a good listener. That's why we have 2 ears and 1 mouth, because listening is so important.
Yeah, I love that. Thank you. Thank you for sharing that. It's so beautiful.
No, I thank you for your time. I thank you for sharing your CanDo. I'm very, very proud of your business success and wish you nothing but greatness in the future, each and every day. Do me a favor, tell our listening audience how they get a hold of you. You kind of mentioned it before, but please mention it again.
So I have a website, gestationaldiabetesnutritionist.com, or they can reach out to me on my Instagram. I have 2. I have gestational period diabetes period diet, and then I have one that's nutritious underscore ginger. And so the nutritious underscore ginger is more like the travel photos you were talking about, some inspirational quotes, things like that, kind of the mental health and wellness. And then the gestational period diabetes period.com is more focused on recipes, controlling your blood sugars, things like that. And anyone can benefit from it. You don't have to be pregnant or have gestational diabetes. You just have to be wanting to help control your blood sugars a little bit more.
Great. Well, again, thank you for your time, your expertise. Have a wonderful rest of the afternoon, and hopefully we'll see you at Expo West or sometimes
I
our
hope
path.
so. I hope so. All right. Thank you so much for your time.
You take care.
You too.
Bye now.